In this video, we're going to be discussing one of the special tests used in the assessment of thoracic outlet syndrome, and that is Adson's test. To perform Adson's test, the PT is going to palpate and monitor the patient's radial pulse throughout the duration of the test. So obviously the first step is to find the radial pulse, and once you have it, you're going to continue assessing it throughout the remainder of the test. From here, the PT is going to passively position the patient's upper extremity in maximal shoulder extension, about 15 to 30 degrees of shoulder abduction, and then external rotation with the elbow straight. So let's get that position right here. So external rotation is with the palm facing forward. There's the abduction of the shoulder, and then bringing it back to shoulder extension. One quick side note, some sources will actually say to skip this bullet point right here pertaining to the shoulder position and basically not do anything with the shoulder and proceed from palpating the radial pulse directly to neck extension and rotation. That being said, the next step is the patient's going to extend their neck and rotate their neck toward the affected side or the test side. In this case, it's going to be toward the physical therapist. So while holding that shoulder position, they're going to tilt their neck backwards into extension and rotate toward the test side as you see right there. While maintaining this position of both the neck and the shoulder, the patient's then going to take a deep breath in and hold. After they hold their breath for as long as possible, the patient can obviously continue breathing normally as needed, but the test position itself can be maintained for up to 30 seconds. And a positive test is going to be a complete disappearance of the radial pulse, or at least a decrease in the vigor or strength of the radial pulse. They may also get provocation of familiar symptoms into the test side upper extremity. And you should always compare that pulse response to the asymptomatic side. As a standalone test, the psychometrics of Adson's tests are fairly weak. The sensitivity is only 79% and the specificity is only 76%. Therefore, you would not use Adson's test as a standalone test for either ruling down or ruling up thoracic outlet syndrome. You would use the result of this test in conjunction with the results of the other tests that are used in the assessment of thoracic outlet syndrome. Let's take one more look at how Adson's test is conducted. So the patient's going to be sitting or standing. The PT is going to palpate the radial pulse and monitor its vigor or strength throughout the duration of the test. The PT may passively position the patient's shoulder into external rotation, about 15 to 30 degrees of abduction, and maximum shoulder extension. From here, the patient is instructed to extend their neck, so tilt it backwards, looking up at the ceiling, and then rotate toward the test side, towards the physical therapist. And then the patient's going to take a deep breath and hold it. Once they can't hold it any longer, they may breathe normally, but the test position can be maintained for up to 30 seconds. Always continue to monitor the vigor of the radial pulse throughout the test. Thank you for all your support. Be sure to check out my Instagram for cool science and not science stuff.